And we're live. It is Friday evening here with Dr. Mike Desjardins. You're coming at us from Baltimore, Maryland. Is that right?
Yep, I've been in Baltimore for a couple weeks, but yeah, I've been traveling around to Connecticut, to North Carolina, where my girlfriend is. But I am
Mm-hmm.
based in Baltimore, where Johns Hopkins is.
Are you able to work remotely now? Is that why you're traveling?
Yeah, I've been working remotely since the beginning of March.
Mm.
I started my postdoc in January, I
Yeah.
think somewhere around the 21st or something. And then, yes, I didn't get much time in the office before COVID hit. So,
So this is 2020. All right. So you've been working
yeah,
remotely since March of 2020,
yeah.
which
So
is
it's
a year
essentially
ago
been one
now.
year. Yeah.
Yeah. It's now March 5th, 2021. This is for posterity. It's a little bit chilly here in Waterbury. How's the weather down in Baltimore?
Yeah, I got into the 50s this week, but went to get a pizza before and it was pretty chilly. So,
How's the pizza in Baltimore?
oh, it's terrible.
Hmm.
Coming from Connecticut, can't really beat it. Um, there's one place that I really like right next to me in this neighborhood called Mount Vernon.
Hmm.
They do like a nice thin crust,
Shout out.
fancy. Yeah, shout them
Um,
out to Iggy's. Yeah.
I've been seeing a lot of resurgence of that. Like Connecticut has the best pizza, sort of talk, which I don't know. I mean, it's definitely pretty good pizza, but is it better than New York? Who's to say? Probably depends.
I've had a lot of New York pizza, but I don't know. There's just something comforting about even just Waterbury pizza.
What's your favorite spot, or do you have a favorite like top three?
Top three in Waterbury
Yeah, in the world.
in the world. Jeez.
Mine would be I like Dominic's and Vinny's
Yes,
in
that's
Waterbury.
definitely either top two.
Martino's in Oakville,
Never had
probably
it.
top two, and then I don't know. There's a bunch of ties for top three, like just a nice thin with a sweet sauce, kind of New York style.
Yeah, Dominic and Pia's is up there for sure.
Did I say Dominic and Pia's or Dominic and Vinny's?
Dominic and Vinny's.
Yeah. Dominic and Pia's is usually more popular, but
Yeah.
um, all right. What was I gonna ask you? Oh, so we're gonna get into the career stuff. What is your job
Food tour.
title right now?
So I'm a postdoctoral fellow
Okay.
in epidemiology,
Mm-hmm.
and I work in the Spatial Science for Public Health Center here at Hopkins Bloomberg School of Public Health.
So the short term for that would be you're doing a postdoc, right?
Yeah, I'm doing a postdoc.
So you completed your PhD in what year?
I completed my PhD in December of 2019.
And then you started the postdoc just in January, and then COVID hit, and it's been a grand old time since then.
Yeah, being a spatial epidemiologist, it was definitely a bittersweet year. My career definitely has been elevated. Um,
Yeah.
I've published a lot of COVID-19 studies. I'm still working on some COVID stuff, so that was nice. I've done a lot of invited talks because of
Mm.
that and workshops, but it really
Nothing
took
more
away.
prestigious than this podcast, though, I'm sure.
No, definitely glad to be here. Um, but yeah, it took away time from what I got hired to do, which is actually water quality monitoring and understanding um, how that affects the propagation of a bacteria called Vibrio perihemolyticus, which is
Mm.
one of the most common bacteria found in shellfish, and it causes foodborne illness
Oh,
and could actually be deadly in certain cases. So, um, yeah, that grant is for the Chesapeake Bay. So that kind of got
right.
postponed for a while. We developed a COVID-19 syndromic surveillance app, which
Okay.
took up a lot of time. And we just published that paper a couple weeks ago, actually, in
What
Scientific
what
Reports.
journal? Yeah, Scientific Reports.
Yeah,
Huh.
which is under Nature, so that was good for exposure.
Is it one of those like Nature Scientific Reports? That would be how it shows up on a web page.
Yeah, exactly.
Uh-huh. I
So
see like
like,
the Nature Reviews is one of them, or like Nature Letters would be another one, right?
yeah, Nature is the top scientific journal in the world.
Mm.
think their impact factor is above 60 or something, or 75. Can't recall. It
Yeah,
varies
so
by year, but Scientific
yeah.
Reports is like 4.5, which is still a great journal.
Yeah, the impact factor, do you know how that's calculated?
Yeah, it has to do with number of publications in the journal and the
Mm,
number of citations per article.
interesting. So shout out to myself. I'm a second author on one article in Frontiers in Human Neuroscience.
That's great.
And I wonder what
Yeah,
the impact factor is. I feel like it's
it sounds legit.
well, Frontiers does a lot of stuff. They do
Yeah, there's frontiers in epidemiology, I believe, as well.
2.673. So I guess according to you, that's decent size.
Yeah, when I'm looking for journals to publish in, anything above 2 is solid.
Mm.
Um, the most cited paper that I have has 107 citations, but the journal has an impact factor of like 5 or 6. So that
Mm.
definitely helped with exposure. And that was
Yeah.
a COVID-19 publication.
So it's kind of like marketing yourself as a researcher, right? You want to pick journals where it's going to get readers. As if like if you're an artist, you want to have your stuff published on sites that with a lot of readers or channels with a lot of viewers, right? Similar deal.
Yeah, publishing is an interesting kind of topic because
Mm.
there's a lot of predator journals where you could publish crappy papers.
Yeah.
The reviews aren't really, they're peer reviewed, but they aren't really rigorous. And you
Yeah.
pay a ridiculous amount of money to get your work published in these journals with very low impact
Right.
factor. And people usually do that just to boost their publication
Right.
list if they're going up for tenure or something.
And it's that way in a lot of fields. I mean, I've seen, so I also kind of, as a hobby, make music and used to do more creative writing. And so I would see a
Yeah.
lot of ads for like basically similar thing. You're paying money for like these not very well known publishing things or paying for people who supposedly will get you more listeners. And yeah, it's basically just a scam. But
It's all BS. I get emails every day from journals that range from gynecology to
mm-hmm,
physics. They
mm-hmm,
just send out, they just spam your email. It doesn't
yeah,
matter what field you're in. You'll get ridiculous journals trying
that's
to
wild.
solicit you for any sort of submission. But yeah, and then for the legit journals, there's open access and then the paywall. So open access is expensive.
Mm,
It could range from 1,500 to 2,500 bucks per article. And this usually comes out of uh, a discretionary fund or some grant fund
so
that,
you're saying the authors, or really probably their university, has to pay the journal to publish the work?
yeah.
Okay,
um
because they're not, the open access is free for readers, right?
yeah, for the general public, anybody could
Right,
click on it and read it.
right,
Otherwise, universities will subscribe to a bunch of journals, and
right.
um, that's where the knowledge gap really gets started, because a lot
Yeah.
of good stuff is not being disseminated to the public because it's behind this
Mm-hmm.
paywall.
Yeah.
um,
Right. A lot of journals are not accessible to the average person, which is funny. I think a lot of people think that the internet just has all knowledge on it.
yeah,
Especially like I've worked educating a lot of like middle school age students, and they just think, oh, I'll just type a question into Google and it'll come out with like the right answer every time. And it's like, no, it's going to come out with a bad answer a lot of the time. But this is something I've experienced because I went to college, graduated in 2016, and had access to like whatever journal I needed really.
yeah.
But then after that, my college grants alumni access to JSTOR, which is
Yeah.
nice, but that's very limited. So when I'm trying to do research on something like ulcerative colitis, which is a medical condition that it's kind of obscure medical research, it's hard to find the cutting edge, really like modern articles on it.
Well, if you go into Google Scholar, you could
Yeah.
type in what you're looking for, and if there's a paywall, just let me know and I could send you the PDF.
That's true. My yeah, I had a friend who did that for me because I had JSTOR access, but that's true. So I usually do use Google Scholar, but
Yeah.
forgot I have connections that might be able to get me papers.
Yeah, and people do that all the time, even though it's behind a paywall. People will ask to see the full text, and yeah, people share the copies
Yeah,
all the time.
I've heard often you just if you email the author, they'll share it with you because
Yeah, of course,
you know,
not like, oh no, you got to pay
yeah,
$45 for this one article, which
right,
nobody does because that goes straight to the journal.
right,
Authors don't get paid for publishing, and reviewing papers is another interesting thing. So obviously in science, the publications are peer reviewed, which is typically conducted by an editor.
right.
So you have to pass the editor, the desk exam, and then if it fits the journal's scope, it gets sent to the reviewers.
Mm-hmm.
So then you have 2 to 3 reviewers, and there's a lot of talk now is, do we pay reviewers for their services? And I think we should,
Mm-hmm.
because we're
So
paying the journal to publish, and then we have to also spend a lot of time volunteering a lot of time to
right,
review papers because that's how it works. And the
right,
only people making out are the journals. So I
right.
think they're, yeah.
So currently the peer review process is kind of like it's like an academic fellowship thing, right? Where people like scientists, researchers will review each other's work for like free of charge for a journal, and it's to ensure the integrity of the publication.
Yeah. And what most journals do after you review a paper for a journal, they'll give you like free access to Scopus or Science Direct
Mm-hmm.
or their journals for 30 days or 6 months, but you already have access anyway if you're in academia. So
Right.
it's nothing. Um, I think the most amount I've gotten for a review is like $50.
So about how many peer reviews have you done?
Well, because of COVID last year, a lot of people wanted me as a reviewer because I was
Mm.
one of the first people with the geographic background to study
Okay.
the disease. So there was a lot of papers coming in from epidemiology journals applying spatial and geographic techniques to study COVID-19. So I did about, say, over 20, 25 reviews in 2020, and
Mm-hmm.
I've done 3 so far in 2021.
So, but before that
You
though,
gotta say no.
Did you do any while you were working on your PhD?
Yeah, I've done, I think, 3 when I was a PhD
Mm-hmm.
student. Um, Typically, your advisor should, hand off some reviews to you for
Mm-hmm.
experience, especially if you're a senior PhD student.
Right. Makes sense.
So yeah, it takes up a lot of time, but it's a good way to, you know, keep in touch with the field and see what's being produced. And
Mm-hmm.
um, I've met colleagues because of that. Person from Mexico reached out to me last week to be on a paper as a consultant, and we just submitted to Science of the Total Environment last night. So, through these
Huh.
reviews and
So they kind
uh,
of like asked you out of the blue, like to be essentially at contribute to their paper.
yeah, they had me review the first paper that was published, and then they
Mm-hmm.
contacted me to be an author on the second paper, which is a follow-up paper on um, spatial methods in COVID-19 for the second half of 2020. So I was like, sure, why not? Um, a lot of it was correcting the English, but there was also some methodological
Right.
things I had to correct. And
Right.
yeah, people will do that, just have you on as a consultant. And
Yeah.
it's a good opportunity just to get more exposure. And
That's something I'm surprised that more people don't do is have somebody correct the English. Because I've read a lot of papers that, I mean, I understand people are in other countries and not native speakers, but like
yeah,
you think you could have a native speaker revise the English before publishing it. I don't know.
I could be wrong. I think some journals do have resources to correct the English, but I've done reviews where I couldn't understand what they were trying to say. So I would
Right.
say, please have a native English speaker revise
Right.
the text or review it.
Yeah. And would you say that like I don't know if you would even know, but like it seems to me that the vast majority of academic scholarship is being published in English nowadays.
Yeah, I would say all the top journals, most of the studies that you'll see and just my experience doing literature reviews and research.
Mhm.
Yeah, whether you're from the US or Europe, South America, if you
Right.
want your
It's
work to be
all in
noticed, it's going to be
English.
in an English journal.
So the lingua franca, the French language, no,
Hmm.
the international language. The English were just such good colonizers, and this is their legacy. Like the
Yeah,
Romans before them.
really lucky to grow up in the US where I don't have to
Right.
be bilingual.
Right. So we have that cultural capital of being a native English speaker. I mean, I know people who have gone and taught English, just like you get a job just because you're a native speaker of English, you can get a job like in Indonesia or Thailand teaching English for a time.
Yeah, I
So
know a few people that have done that as well. And
exactly,
I
it's
think that's
definitely
amazing. And I really feel for the international students that come here and try to become great scientists. And the one thing that they're lacking is that writing experience, writing in English. And,
right.
uh, I try to help friends when I can and revise their work. Um, but yeah, I worry about them because, when they're up for jobs, when they're
Right.
doing their dissertation, does that prolong the process for them? Um,
Yeah, it's a shame.
I've experienced, you know, advisors that were of the same ethnicity,
Mm-hmm.
spoke the same language as them, and would only speak to them in that language. So that
Right.
would just, exacerbate the issue of communicating in
Mm.
English and writing in English. So yeah, so I think there's a lot that goes into it, but yeah, I really respect international scholars that are constantly trying to improve their
Sure.
communication in English, and I'm always willing to help because I've done work in Colombia, and without the help of the Colombians, my dissertation would have been prolonged by maybe another year.
Mm. So I'm dying to get into the details of your research. You mentioned that you do spatial epidemiology, and you said that has something to do with geography. So could you explain what that means?
Yeah, so all three of my degrees are in geography,
Okay.
and you know people would make fun of me for it. Geography, you just make maps, or
uh
about capitals and whatnot.
huh.
But the problem is geographic education is not really in the curriculum in high school and
No.
grammar school. I didn't find out about geography until I was a sophomore uh, at Keene State College. I joined as
Mm.
a psych major
Okay.
and switched majors because I realized that I love maps and traveling and culture and whatever. But then I
Mm.
realized geography is so much more. It's about spatial thinking. Why
Mm.
does location matter?
Right.
Most decision making involves a where question, and
Mm.
more often than not, decisions will have geographic consequences. So we
Mm.
study the effects of location. For example, the impact of a new light rail in a city
Mm.
like Charlotte. How does that affect property values?
Mm.
Disease, obviously, where you're located is going to affect your exposure to certain
Right.
things and risk of transmission. So what we try to do in a lot of our research is quantify, kind of discuss spatial interaction,
Yeah.
how different, well, depending on what scale you're looking at. Um, for example, how do neighborhoods interact?
Right.
How does that affect health outcomes?
Right.
Um, there's actually one law in geography, Tobler's first law of geography,
Uh
that
huh.
says that all things are related, but near things are more related than things that are far away.
Makes
Now,
sense.
this is like the theory behind a lot of spatial modeling and statistics, but
Mm.
that theory or that law has been updated several times because of technology.
Right.
Things that are connected or more related, and it's not necessarily related to physical proximity.
Mm.
So if you think about transportation networks and whatever, so
Right. Or
it gets
internet.
complicated
Yeah.
really fast.
Yeah.
Um,
With media, I mean, I guess you could make the argument that like people in New York are more connected with people in Los Angeles than with people in like Vermont.
exactly.
Yeah.
And yeah, there's a lot of spatial statistics and techniques to kind of understand those relationships. and the impact
Okay.
that not just physical proximity, but also network,
Right.
whether it's social networks, work networks, transportation networks, how does that affect
Yeah.
health outcomes, the economy?
This seems extremely interdisciplinary, right? Because you're kind of talking about economics, you're talking about sociology, you're talking about epidemiology, you're talking about communications,
Yeah,
statistics. Yeah.
I think geographers are very well rounded, and
Yeah.
they're in a lot of positions that don't have the title geographer.
Right.
You know, urban planners,
Mm.
um, geographic information systems specialists,
GIS.
GIS. Yeah, so when people think of geography nowadays, they think of GIS, which is one of
Right.
the fastest growing markets in science and technology because people want to see a map. They want to see locations and how
Mm-hmm.
does that affect, you know, if I want to locate a new business, where should I locate it based on all these variables?
Right.
Um, and we've seen how maps in spatial analysis has improved our understanding of the COVID-19 pandemic with
Oh yeah.
the
Mm-hmm.
Hopkins Dashboard, for example.
Could you tell what is that?
Um, yeah, it's GIS. So it's the dashboard is based on Esri, which is the largest software company for GIS in the world.
Mm-hmm.
Um, so I'm sure everyone's familiar with the Hopkins dashboard. That
I'm not at all. I'm looking it up right now.
okay, so yeah, they started tracking the cases very early on.
Yeah.
I think they started in February.
Mm-hmm.
I met the PhD student who came up with the idea and programmed it. Um, it actually wasn't geographers that did that; it was engineers. So they also consulted with Esri to improve the dashboard and the visual analytics and everything. But
Mm-hmm.
you know, that's where most people get their data from. At least initially, everyone was getting their data from the dashboard
Okay.
because they made the data available in
So
terms of the
I'm
cases and
looking at it
deaths.
here. It's talking about cases by country or region,
Mm-hmm.
deaths by country. So this is kind of like where you get a lot of statistics, and then looks like there's a map trying to load in the middle. And so I'm guessing you can kind of view cases on the map and stuff like rates and cases and stuff like that.
Yeah, it's very effective for what it does
Mm-hmm.
for just the general public to see
Mm-hmm.
and kind of track the evolution of transmission over time.
Yeah.
But there's a lot of other things that could be done, but might be more difficult for people to understand. Like if you get into relative risk of the disease and
Mm-hmm.
if you start adding some actual modeling results to that, that would be informative, but you would really have to like do some reading to understand what the results mean.
So can you get that on the Hopkins dashboard or no?
They have a GitHub. So GitHub is where you share, it's mainly for sharing code, but you could also share data on there. And
Mm.
their data is updated multiple times a day.
Okay.
So for my COVID research, I, yeah, essentially collected the data from that website, um, which includes cases by uh, country,
Mm-hmm.
state, and also by county. So
Right.
that was really useful to get
Yeah.
my COVID research up and running.
Yeah. Johns Hopkins is like the world leader in public health, aren't they? They're pretty much known for that.
Yeah, we have the oldest and largest department of epidemiology in the world.
Right.
And I think it's the largest school of public health in the world. Um,
Yeah. My friend actually just started a master's there. I don't know. Well, you probably, if it's so big, you probably haven't met her. Her name is Liz Tawa.
yeah,
But
there's thousands of students that come here. Yeah, especially with the pandemic, I haven't been able to really meet a lot of
right.
people at
Not a lot of
Hopkins.
meet and greets going on.
Yeah, just besides the engineers and the physicians that helped develop the
Mm.
COVID app. Um,
Okay. So let's talk about what how would you define spatial epidemiology?
so spatial epidemiology is different than traditional epidemiology.
So what's traditional epidemiology?
well, it's the study of disease and transmission
Right.
and the causes behind the disease,
Right.
whether
So
it's
this is
sociodemographic factors, environmental
right.
factors.
So epidemiologists are really the people who make the recommendations, right, about like wearing masks and social distancing and all the things we hear, like 6 feet apart or gatherings of no more than 10. Wouldn't those guidelines have been created by epidemiologists?
Correct. Yeah, a lot of the public health people behind the scenes are epidemiologists
Mm-hmm.
making these guidelines or suggesting the guidelines to the actual politicians that
Yeah, I
could
would
do
hope
whatever they
so.
want with.
I would hope I would hope that there's the experts behind the scenes and not just politicians making stuff up. I actually heard just yesterday about the president of I don't want to get this wrong, but I think it's Zambia in
Hmm.
Africa, how they're kind of just ignoring all like the international public health guidelines, and they're doing like steam rooms to fight COVID, and they claim that they have eliminated it from the country. Actually, I think it's Zimbabwe. It's an African country that starts with Z,
I
but
was going to say if it was Zambia, that's interesting because we have very strong ties with Zambia to reduce their malaria,
mm,
um, because we
yeah,
have a Bill Gates Foundation grant in a
gotcha.
malaria institute. So
Yeah,
I
I think
haven't
it's
heard that, so I'll have to.
Zimbabwe, who's like
Okay.
the one country that's like completely ignoring and denying COVID. But
Well, we
any
have a lot of
case,
those deniers in the U.S. anyway. That doesn't
right?
help when you have Texas and
That's
Florida
true. So,
removing mask mandates. But
but I kind of interrupted you. So, spatial epidemiology is different. How?
so we bring location into the mix. So how does
Right.
location affect health outcomes?
Okay.
So actual, so for example, I'm in a neighborhood in Baltimore.
Mm-hmm.
What do surrounding neighborhoods in Baltimore look like, and how does that affect my chance of getting COVID-19?
Mm-hmm.
So there's ways to quantify the relationship between um, locations and how
Mm-hmm.
they influence each other.
Mm-hmm.
So we try to understand how spatial proximity, and if you want to get even more technical, spatial and temporal proximity
Mm-hmm.
impacts health outcomes over time.
Mm-hmm.
So the first example of spatial epidemiology, um, I think there was actually an earlier example, but the most famous one is the Jon Snow Ghost Map,
Okay.
uh, which is on the it's about the cholera epidemic back in London in the 1840s, which
Mm-hmm.
killed tens of thousands of people. And this was when people used to think cholera was caused by miasma or bad air.
Mm-hmm.
Um, and they thought that, poor people were dirtier, so they're more likely to transmit and have cholera.
Mm-hmm.
But Dr. Jon Snow didn't buy this. So what he did, he went around London with a map
Mm-hmm.
and he essentially mapped all of the cases and deaths in London.
Mm-hmm.
And most of the cases were in Soho in London,
Mm-hmm.
and on a street called Broad Street. And doing some spatial analysis, very primitive spatial analysis at the time, he found out that the majority of the cases and deaths were located um, near this one water pump where people were getting their water
Oh.
from. So essentially, um, the first case of cholera was linked back to, I believe, an infant who had it, and then they were throwing the diapers and
Oh, in the
created a
water.
cesspool in the water. And so to support this kind of germ theory or waterborne theory, they
Mm-hmm.
shut off the pump and then the
Yeah.
cases substantially reduced over time.
Okay.
But it still took, I think, decades before people accepted the germ theory
Mm.
that there's microorganisms that cause illness.
Yeah, I don't remember the history of that, but that's obviously a huge landmark, right? In how people think about health is believing in germs, microscopic
Yeah.
things, and then um, yeah, I don't know. I mean, because there was like Louis Pasteur in like the early 1900s with like pasteurization, and then
Exactly.
vaccines. Who's the guy who invented one of the first vaccines?
uh Jonas Salk, or was that polio?
I don't know, but vaccines are kind of a last 100 years thing as well, right?
Yeah.
Um, yeah, it's interesting if you talk to like people in our grandparents' generation, they remember. It's like history repeats. I was talking to my
Yeah.
grandmother a couple weeks ago, and she's like, "I remember like when they rolled out the polio vaccine, and like everybody had to get vaccinated, or like
Hmm.
I remember we had the mumps and measles vaccine, and like to them, vaccines are kind of a new thing, but it was a similar deal where like there was a lot of push to get everybody vaccinated, and like it actually worked. Like they eliminated polio, they eliminated
Smallpox.
smallpox.
Exactly.
Yeah. So
And
I think this is something that a lot of people like. It shows we failed to educate people on history. The fact that people deny like the effectiveness of vaccines.
yeah, and
Yeah.
we essentially eradicated um, you know, measles and the mumps, but
Hmm.
people aren't vaccinating their kids now, so we're seeing small clusters of
Right.
measles in certain populations.
Yeah. So did I ever learn about vaccines in a history class? No.
No, we never did.
Never learned about public health really at all in history classes. Did I learn about the succession of the monarchs in England in the 1500s? Yes.
Yes.
Well, I don't know why. Don't know why I had to learn that. But
Yeah. When we think about health education, it's about individual health, not public health.
right.
And public health starts from the individual level.
Hmm.
And then, you know, a lot of people don't have collectivist thinking. Certain animal species have evolved over time to reduce disease in their populations. If a freaking
Hmm.
lobster, a monkey could social distance to reduce the chance that they get sick
Yeah.
to save future generations, then I think we owe it to our fellow human to do the same.
Hmm. Yeah. I mean, don't get me
And
started on like the what we should or shouldn't teach in schools. That's something that I could go on about, but I really would like to get some more into the research that you've been doing.
sure.
So we talked a little bit about what spatial epidemiology is. Is that what you did your doctorate on, or did you get into
Uh,
epidemiology after your doctorate?
Um, so my bachelor's was on applying GIS to coral reef conservation.
Mm-hmm.
Um, so I wanted to see how spatial analysis could study, um, you know, the species and the different types of corals in the Turks and Caicos
Mm-hmm.
to kind
What
of
is that?
understand. Turks and Caicos is an island chain kind of east of the Bahamas in the Caribbean.
Okay.
They have some of the most pristine coral reefs on the planet.
Mm-hmm.
And I was lucky to write and get a grant to go travel there and take. So I'm certified in scuba, and I was able to collect data,
Mm-hmm.
go down there along a transect line and look at all the fish and the
Very
corals, write that
nice.
down, and then apply my geography skills to understand the health of the coral reef that we
Mm-hmm.
were studying that time. So, yeah, my background first was in kind of conservation, marine science.
Right.
And then my master's was kind of honing my skills in GIS, but more technical. So, building my programming skills, building my statistical knowledge,
Right.
and kind of visualization, cartography.
Mm-hmm.
Um, but I applied it to nature reserve design.
Okay.
So my master's is in optimization. So kind of, developing models to identify the best location for certain things.
Mm-hmm.
So there's a lot that goes into these models. So decision makers will have a list of items that they want. So you develop your model and then it spits out kind of, you know, what these ideal locations are based on the constraints that you give.
Hmm. It reminds me
So
of a math problem that I did in high school. It was a scholarship contest.
yeah.
Me and two friends, Adam Quiquaro, who you know, and another
Mm-hmm.
kid who you probably don't, went in on it and tried to like win the scholarship. And it was an optimization problem of like where would be the best location in the United States to build a high speed rail line. And it was like, for example, study the Amtrak Acela rail line, which already
Mm-hmm.
exists in the Northeast Corridor. And it was like, build a mathematical model that shows where would be the best place to build another rail line. knowing what I know now, we should have just been like, well, obviously it's going to be in California, and then just work backwards from there. But
Yeah, so you already had spatial thinking back in the day.
yeah, in a way. But so did you do a thesis in undergrad? Like what, or to put it this way, what question were you trying to answer with your coral reef research, and what did you find? What were your findings?
Yeah, I did a well, okay, so I did a thesis in my undergrad that was on um, the health of this kind of forested area in a nearby town next to Keene State College,
Okay.
um, kind of looking at recreational opportunities and conservation and whatnot based on the resources that existed and what was threatened. So
Okay.
that was a group kind of thesis, which really helped me prepare for grad school. But then my other big project was the reef stuff, where I wrote a grant and then came back and um, yeah, wrote a paper and had a poster presented at a conference.
Mm-hmm.
So yeah, that was the more interesting projects of my
So
out
what
of
were
the
you
two.
what were
Yeah,
your
yeah.
findings?
Yeah, so it was a mixed methods kind of study
Mm-hmm.
where I collected, you know, data using scuba
Mm-hmm.
to understand what was actually in the reef, studying the health of the reef, the abundance of certain species. Um, if there's umbrella species, so if there's you know, certain large species in this reef, then
Mm-hmm.
we know that there's going to be a lot of smaller species. So that could be an
Okay.
indicator. So there's indicator species essentially. So
Got it.
um, I also looked at the substrate, so the different types of corals and uh, yeah, just what kind of the area was made up of. And I used GIS to look at the health, and I found that essentially the reef was doing well compared to other reefs that I studied,
Mm.
based on literature reviews and whatever. And I gave a bunch of reasons why. Um, and that reef collects data every year. So I was kind of just thrown into the fire for 1 year. So I didn't really have
Mm.
enough to do like a longitudinal study,
Right.
but it was enough to say that GIS can be applied to this reef, make a map of what is there, and
Mm-hmm.
use that for decision making.
Okay.
Um, but I also did some interviews as well. So I interviewed um, dive shop owners, scuba masters, and actually some high school students
Mm-hmm.
about kind of their perspectives on coral reef conservation. And the local islanders are like, we don't really care. Um,
Oh,
we don't really go out into the water.
right.
Um, in the Turks and Caicos, it's like a white problem, honestly. Like,
Mm.
because all the tourists come, and
Right.
then they think the reef is like it's a rock, which it's not. It's a living organism, so they would damage the reef.
Oh.
Um, they would, you know, a lot of resorts popped up, so they would dredge the area, and
Oh.
then yeah, people would go into the water and screw up all the just kind of the ecosystems there. So I wanted
Sure.
to see, you know, from a high school student perspective, what do you think about conservation? What do you know about it? Why is it important?
And they were like,
Yeah, I mean, reefs contain 30% of all species on the planet. They're
right.
essentially barriers that's how we get, the nice sand that we get.
Right.
That's why there's crystal clear water. It's like a filter.
Oh, so is that why Connecticut beaches suck?
Yeah,
Because we
there's
don't have any reefs? Or is it just the Long Island Sound that's basically just a cesspool?
yeah, both of those things.
Shout out to Connecticut beaches.
Yeah. So that was my undergrad. And like I said, when I got into grad school, I just wanted to really get into GIS more because I did
Yeah.
some crime analysis of just general crime in Waterbury,
Oh,
which was
interesting.
interesting.
What did you
And
find with that?
the majority of crimes committed in Waterbury was in a 1 kilometer buffer of
I
the
feel like I
mall
can guess. Oh, in the mall.
yeah, like So if the mall is like the starting point, a
Yeah.
mile radius around the mall, like the majority of the crimes occurred. So
A
kind of
mile or
makes
a kilometer?
a mile.
Mm.
Before I started using, metric units. Yeah.
Because initially you said kilometer, but
Oh,
yeah.
yeah.
Yeah, I mean
Um,
that makes sense.
and
The area behind the mall is a really dingy area. That's where actually I used to work at Walsh Elementary School, and there's just tons
okay.
of like broken windows, abandoned buildings.
Yeah.
There's also a soup kitchen there and a drop-in center for homeless people there. So it's a very poor, crime-ridden area. But
Yeah, it made sense after I kind of did some ground truthing where I looked at, where is the drug crime, where is the violent crime, and so on.
yeah,
So it was a interesting kind of start into my career using
yes,
GIS.
that's really interesting. Questions of like why is something like crime concentrated in certain areas? Why
Yeah,
is something
and
like, I mean, same thing with why is anything
mhm.
concentrated in certain areas, right? And so GIS, I feel like I still am not clear on what exactly you do with GIS. You make maps of it, right?
So the maps are like the last thing that you do. That's, I would say, the minority of GIS.
Mm-hmm.
Um, there are cartographers whose job is just to make pretty maps, but
Mm-hmm.
you need to have some sort of results to make the map. So
Yeah.
in GIS, there's a lot of statistics that you
Mm-hmm.
can apply to certain problems. So where are there clusters of crimes, of violent crimes versus uh, drug crimes and so on? Where
Yeah.
are there clusters of low values? So where there's not a lot of crime, and then you could
Right.
compare that.
So what
And
I'm kind of picturing, what I would do with somebody who doesn't have the training, if I
yeah,
wanted to do this, I would like get a map, probably a physical map, because I don't know how to use mapping software, and like find out, do research, where were the crimes reported, and then just take like little dots or pins and just put them on the map, and then I could see the physical clusters of things. So how is GIS different from that?
well, GIS is digital first of all. So
Okay,
before that was the primitive way of doing things, but
sure.
um, GIS has really evolved throughout the years in terms of the types of tools that are used to evaluate spatial phenomena.
Mm-hmm.
Um, so it's not just about where something is. Just
Mm-hmm.
because something looks clustered visually, it doesn't mean that
Right.
it's clustered statistically.
Mm.
Because you could have a cluster of crimes if you put pins on the map, but that could be a function of the population. We
Right.
expect that crime is going to be higher in certain areas in certain times of the year.
Right.
So there's
It doesn't explain
statistics.
what's causing it really.
Exactly.
It shows correlations but not causes.
Yeah. So there's methods to account or adjust for population and other
Mm.
things to help better explain where the true clusters are, where we're seeing more observed than expected, for example.
Okay.
And then you could get into spatial regression, um, looking at, what variables have a relationship, significant relationship with, say, crime or disease, and what is the spatial kind of interaction between those variables.
Mm. So did you this research on Waterbury, was that something for school or just you did on your own?
That was for fundamentals of GIS. That was
Okay.
the first GIS class I took, and
Got
that's
it.
why I fell in love, because I called the police station and asked for the data, and they gave it to me, and I got an Excel sheet, put it on a map, and then
Right.
used a bunch of methods to kind of study crime in Waterbury.
And any interesting findings on that other than just like the cluster around the mall?
Yeah, I did a bunch of other things, but honestly, I forgot by now. That was the
Yeah,
first. Yeah, I've done so many other things since that.
makes
But
sense. All right, so let's talk about some of the other things. What some other research you've done that you'd like to talk about? Help us understand. I mean, whatever. What are you most excited about in your research?
yeah, so I guess after my master's, I did that was on optimization. Then I really started getting into medical geography, which is a broader term which includes spatial epidemiology.
Yeah.
Um, so that's just like geographic health. So the
Mm-hmm.
study of health, but from geographic perspectives. And then
Okay.
spatial epidemiology is more focused on just disease.
So, what are some questions that this medical geography answers? Is it things like where do people live the longest? Where is there the highest concentration of HIV? Stuff like that.
Yeah, essentially where and why
And
certain health.
why. So I feel
Yeah,
like the why is probably the much harder question, right? Because
yeah,
the
that's when you get
where is
into
not
the
that hard. But
no, that's when you get into the modeling and the statistics, which could get complicated,
mm,
um, because you're adding that spatial component. So this might be too technical for an interview like this, but if
nah,
you run
dude,
a regular
we're going in technical.
all right, so if you run a regular regression model
Mm,
in geography, you would take the error or the residuals of that model
mm,
and see if they're spatially autocorrelated, meaning that there's leftover spatial autocorrelation of the residuals, meaning that the model could better explain the outcome if you include geography.
okay.
So that's where spatial regression comes in, that you include the spatial interaction of the locations in your analysis, which could better explain the outcome.
Okay.
Because again, it goes back to the first law of geography. Near things are more related than things far away. And we use these models to test that.
Mm. So a regression is kind of, is it where you have like an XY axis and you kind of have a bunch of data points? Well, this is a linear regression, I
Yeah.
suppose, right? Where you
So yeah,
draw out a
linear regression
line.
is the first thing that you typically do before any spatial regression
Okay. So can you give an example of like how you'd go through this process?
of a regression.
Yeah, of creating like the spatial regression.
Yeah. So it's funny because my girlfriend is actually doing that for her master's thesis and I need to help her with that. So
So this is a
um,
practice run.
yeah. So in regression, we're interested on how independent variables have a significant relationship with the dependent variable. So
Right.
say our dependent variable is COVID-19 cases.
Mm-hmm.
What is significantly related, whether it's positive or negative? So
Right.
what can increase COVID risk or decrease COVID risk?
Right. So living in a densely populated area could be one, right?
Exactly.
So on your x-axis, you could have population density, right? And on your
Mm-hmm.
y-axis would be COVID risk, which would obviously correlate pretty strongly.
Yeah, and that will depend on the disease and the time period where those data points are taken. But yeah, essentially, that's correct. And then you want to make sure that your independent variables are not related to each other, hence
Okay.
independent variables. So there's a test uh, to test for multicollinearity. So, you know, income could be, sadly, it's often a proxy for race as well.
Right. In America, at least. Well, in a lot of countries, actually.
Yeah, in a lot of countries. So minority groups typically are paid less. So those
Mm-hmm.
two variables might be correlated. So you
Right.
have to toss one of those out.
You can't use both.
So you can't use both.
Okay.
So there's tests to show the degree of relationship between your independent variables. So once you
Right.
confirm that your independent variables are not related, you could throw them into the model and then you start seeing what's significant.
Is this what's called independent component analysis or no? It sounds kind of like what I know about that.
Um, you mean principal component analysis?
Maybe. Something, yeah, I think that principal component analysis, yeah.
Yeah, that's part of the process. Yeah.
Okay.
I've, um, yeah. So essentially, it's just a lot about teasing out variables that are not related to each other, but related to the dependent variable.
Right.
Um, and then there's statistics in the model that'll tell you how well it explains the variation of the phenomena.
Mm-hmm.
So we use, say, R squared would be like the popular
Right.
statistic. The higher your R squared, the higher or the better your model kind of explains what's going on.
Mm-hmm.
And a lot of times when we do spatial regression, that R squared could be increased because you're just bringing in geography now, locations. Why
Right.
does that matter?
Right. I mean, with something like disease spreading, it seems obvious why location would matter. What are some examples where it's like not obvious that location matters, but it actually does?
Not obvious. I mean, that's a good question because, like I said, the figure I threw out at you before, like 70% of our decisions involve a where question. I mean, some things that we think are related spatially are actually not. So there's a lot of statistics that tell you if, say, disease cases are clustered, dispersed, or spatially random. So this is done a lot in ecology when you look at different types of habitats, look at disease or crime, and that could tell you a lot about kind of the relationship between different crimes or different disease patterns, how it's being dispersed into other locations and so on. So I don't know if that answered your question exactly, but that's a good question.
I have so many questions about this topic. I think
no, it's a good question. You essentially test for that.
Yeah.
You could bring in anything you want and see if location matters for whatever you're observing.
Got it.
So that's like the power of that's like one of the first things you would do with like a spatial data set, anything with coordinates.
So you must quantify it, right? You must turn the distance into numbers and then somehow enter that into your regression. Is that right?
Yeah, so you categorize the spatial relationships through a variety of different weight matrices.
Okay.
So you define, how are the locations kind of interacting initially. So a common thing to do is say that my location is connected to the adjacent locations. So there's a greater likelihood that what happens in adjacent neighborhoods will affect me than neighborhoods that are farther away.
Right.
That's what essentially you test for. Again, it goes back to Tobler's first law and, but there's also other weight matrices that you could define. You could do adjacent and then adjacent to those as well. You could kind of look at, we're getting into the uncertain geographic context problem. So, these spatial relationships don't really follow administrative boundaries.
Right.
So you could define these interactions based on certain flows of like mobility of people, like where are people going throughout the day. So maybe downtown Baltimore is more related to me than say northern Baltimore because I spend more time there. And that has more influence on my health outcomes, my exposure to crime, and so on. So yeah, there's a lot of ways to categorize spatial relationships in a model. It really depends on what you're doing and what the research question is. But I will say a common way of defining that kind of spatial weight matrix is using the adjacent locations.
Right. So I feel like I'm still having some trouble understanding how all this works. Maybe if we take a specific example. So you said you've done a lot of stuff during the pandemic about COVID. What's say, I don't know, your favorite paper that you've done or the research that you've done during COVID? And then maybe we can kind of just try to interpret it for the general populace to show like,
so
like what your work is and how it relates
to kind of simplify the first paper that was, it's currently my most popular paper that I've ever published. I was actually surprised that it received so much attention. So back in March, when the pandemic was first happening, my former advisor, my former PhD advisor, and my friend Alex, who I did my PhD with, he's a professor at Utah. We were like, let's contribute to this. So I've done a lot of work in cluster detection and cluster statistics. So what essentially we did is identify clusters of COVID cases every day for, I think it was the first 3 months of the pandemic.
So what is a cluster?
So a cluster there's a lot of definitions on what a cluster actually is. Some public health institutions or governments will say a cluster of a disease is classified by 3 people in a given proximity or 10 people or whatever. But in our case, we looked at county level data.
Yeah.
And we draw or kind of generated these hypothetical clusters around every county. So it would kind of draw a radius around your target county.
Yeah.
Draw a radius and pick up the nearby counties.
Okay.
And then count the number of observed COVID cases in the population.
Okay.
So the population is important because, again, I said, if you don't include population, you would expect that clusters are going to occur in more populated areas because there's more people. So we could use population to get expected number of cases. So we expect more COVID cases in higher populated areas.
Right.
So we generated these search windows that looked at nearby counties and not just adjacent ones, but anything that fell within these circles of different sizes, counted the number of cases, looked at the population, and then the statistic said if there's more observed than expected cases, there's an elevated risk in that area.
Right.
And then we would, well, essentially, there's other things to identify statistical significance, but it could, it's simple as just looking at, what's in the specific location and surrounding locations.
Yeah.
What is observed and what we expect, and what is higher than what we expect, and is it concentrated spatially? So
how do you generate the expected value? You said based on population.
Yeah, so it's a really simple equation, actually. It's used a lot in basic epidemiology as well to compute standardized mortality or morbidity ratios. So if I want to get the expected value of COVID in Waterbury, Connecticut, I would take the population of Waterbury and multiply that by the total rate of COVID in Connecticut.
Why Connecticut?
Because you want to look at the population in that location and then look at the total rate of disease in your entire study area.
Right.
So essentially, the expected values are derived from that population in that one location and the total rate of disease. So it's essentially giving a value based on that total rate. So if there's 200 cases total in Connecticut, I'll give 5 cases to this location. I'll give 10 cases to that location.
Yeah.
It's proportional to the population.
Oh, I gotcha. Understand.
So it's just, population of one location multiplied by the total rate of disease.
Got it.
And you could do that with crime, expected number of crimes. So there's some uncertainty and error that comes from that, but that's, a simple way of saying we expect a certain amount of things in this particular location by looking at what's happening outside of that area.
So just to kind of review this, so you said if there's, let's say,
does that make sense?
More realistic, if there's 100,000 COVID cases in Connecticut, and say Waterbury has 15% of Connecticut's population, we would multiply 15% times 100,000 to get the expected number of cases in Waterbury. Is that right?
Yeah, you would multiply 15%. Multiplied by total cases divided by total population of Connecticut.
Oh, okay. Gotcha.
Yeah, so based on the population of Connecticut and Waterbury, depending on how many cases there are in total, it'll allocate a certain amount of cases to Waterbury, saying we expect this many.
Right.
Because there's this many people there and this many people got it in the entire state.
So I would think that in densely populated areas, though, you would expect higher values just by virtue of them being densely populated, right? So there's easier transmission.
Yeah, this is correct. So there's an assumption there.
Yeah.
And when you have more observed than expected, then we know something's going on because there's more observations than what we expect given baseline conditions.
Right.
So there's ways to kind of quantify uncertainty and error that our estimate of risk is off because of A, B, and C. But it's a good exploratory kind of analysis to identify areas that have an anomalous kind of uptick in COVID cases.
Okay.
So we did this every day, ran
Yeah.
a statistic every day, and the cases also depended on. I think we went back 2 weeks, so it would look at the day of analysis and would go back 2 weeks because COVID has an incubation period up to 14 days. So we accounted for the incubation period. So we didn't just look at space, we also looked at time. How does time affect the clusters? So yeah, we have a website that actually tracks the clusters over time.
Plug it. What is it?
It's called COVID-19scan.net, I believe.
Let's see. Is it still up and running?
Yeah, COVID-19scan.net.
Oh, it's a nice website.
Yeah, I didn't make it. Alex did. So you see the first paper at the bottom there was the first paper that we did. Then we did a follow-up paper, or 2 follow-up papers. One was just in a like a scientific group, so it wasn't peer reviewed,
right,
but it's still published. But the second follow-up paper was peer reviewed in spatial and spatial temporal epidemiology. And we really focused on more visualization.
Right.
So how do we visualize relative risk over time and other kind of statistics you get from our model, observed, expected, the likelihood that the cluster will occur again, and so on.
So what is the importance of this sort of research?
So it's disease surveillance. So we look at kind of the evolution of COVID-19 every day. So we were approached by the CDC and other colleagues from around the world that wanted to utilize this kind of method, this approach, for their own surveillance of COVID. There's obviously a lot of limitations with this approach because we rely on cases that are reported to different databases. So there could be, if there's a lag in testing, there's a lag in cases.
Right.
So the clusters may not capture the true burden of disease, but
right. These are the things that researchers always have to be super careful about, right? Like where could there be an error in the study design or in is there data that we're not measuring that we should be measuring, right?
A lot of studies are data driven. Yeah. So yeah, there's case surveillance, which looks at, clustering. Where do we identify anomalous increases in disease, or in this case, COVID, over space and time? So how many days does a county belong in a cluster? How many observed cases of COVID do we see? What is expected given the population? So all of this we're able to map and quantify every day. So it's useful for people that want to make decisions about, should I enforce stricter public health guidelines and so on. Which gets me to my next kind of big research project on COVID, was the Syndromic Surveillance App.
Okay.
So covidcontrol.ghu.edu, where I'm a big kind of advocate for being proactive in health, individual health and public health. So let's do something about this before it actually happens. So traditional disease surveillance relies heavily on reported cases.
Right.
And a lot happens before those cases are reported. People have symptoms. They feel like they should go to the doctor. They get tested. There's a testing lag. Then they get diagnosed.
Right. A lot of times you've had the disease for a few days before you get tested, right? And then it takes a few days after that.
Exactly.
You could have passed it to people in the interim.
Yeah. So we collaborated with the School of Engineering and the School of Medicine to develop an app for iPhones and Androids, where you could enter your body temperature and COVID-19 like symptoms.
Mm-hmm.
So you would get a notification every day, and then you would put, do I have diarrhea today, or
Mm-hmm.
fever, loss of taste and smell? And if you were healthy, you would say none. So we would
Right.
have cases and controls.
Right.
Cases would be any symptom, one or more. Controls would be no symptoms.
Mm.
And so the app was the first part, kind of our workflow, collecting the data. And this is available at we did the analysis at the county level.
Mm-hmm.
So it protected privacy. We had to go through a ethics board to get approval for this project because we're
Gotcha.
collecting data from individuals,
Right.
health data.
Well, that's reassuring that you had to get approval.
Well, yeah, all these studies have to get approval. So people still don't believe that their privacy is protected. We'll get into that later if you want. But anyways, yeah, so we weren't just collecting data just to collect data for research. We also developed kind of an online dashboard to show the number of symptoms reported in a county every day
Mm-hmm.
for the entire US. And we had a time series of cases or symptoms over time.
Mm-hmm.
And then detecting clusters of symptoms, which is key,
Right.
because if we could detect anomalous upticks in symptoms in a certain
Right.
area, then we know potentially there's an increased risk of COVID transmission. So
Mm-hmm.
this kind of empowers people to take control of their individual and community's health by saying,
Right.
okay, this is how I'm feeling today. And then, you don't know who's sick. You're just reporting
Right.
it, and then it's being aggregated at the county
Right.
level.
Right.
This way we're able to say, okay, this county can expect maybe more COVID cases over time.
So I've heard on the news about like apps like this.
Yeah,
I'm guessing this wasn't the only such app that was created, right?
no, Carnegie Mellon did another app. And then I reviewed a paper in the Lancet for this app in Japan that was actually very successful, that did similar things. And
Isn't
they
the
were able
Lancet
to,
like that British medical journal, like the really popular one?
yeah,
Oh, nice.
yeah. The Japanese, they practice more collectivism. So
Yeah.
they had more users, and they were able to nicely predict COVID clusters before they happened, because a lot of people were entering their COVID symptoms every day.
Yeah. So
And
they
there's a
would.
lot of,
So they. Well, I mean, a cluster before it happened, like they would see like a bunch of people reporting symptoms, and then what would they do? Just tell those people stay inside, or?
yeah, and this was a geographic study. So you would be able to see what neighborhoods or what um, particular region had an uptick in symptoms for
Yeah.
that day or group of days. And
Yeah.
so you would say, if I saw that and it was in my neighborhood, I would say, okay, I'm staying inside today, or I'm not going out for
Mm-hmm.
lunch with my
Right.
colleague today because there's a higher risk. And we've
And
seen
so
that
that you can
syndromic
see that.
surveillance is useful.
Yeah, and it's useful because you get detection earlier than testing positive rates, right?
Yeah. The CDC did a major study, I think in 2013, on the flu, using flu related tweets, actually. So people, which is actually surprising, a lot of people tweet about how they're feeling, symptoms.
Yeah.
So
Yeah.
they were able to correlate flu related tweets to flu cases. So
Whoa.
there was a lag effect, meaning I think 3 to 5 days before cases were being reported, there's an uptick in flu related symptoms.
Wow. Just based on people tweeting it.
So yeah, there's a lot of work in geography using social media, um, extracting tweets, because people turn on their
Yeah.
location.
Yeah.
That's considered volunteer geographic information.
Mm-hmm.
And you take the location and the content of that tweet, and then you could do a lot of interesting analysis with that. kind
Yeah,
of,
I remember one
yeah.
study that was in the news about the most unhappy places in America,
Hmm.
featuring Waterbury, Connecticut at the top of
Yep.
the list.
Yep.
Based on people's depressed tweets.
Yeah. Social media analysis is really interesting. It involves, linguistics. What are people
Right,
tweeting about? Is it
right,
negative? Is it positive?
right. And that's a lot more ambiguous, but somebody
Yeah,
tweeting whether or not they have a symptom is probably, well, that's somewhat ambiguous too, because a lot of people would probably just tweet like feeling so shitty right now.
exactly. So
Is it
there's a lot of
emotional? Is it
noise.
physical? Yeah.
Yeah, because you could say, I'm sick, I have a headache. A headache can be
Mm-hmm.
indicative of so many things.
Right. Or even an emotional headache. Right.
Yeah. So
But in any
it's
case,
useful in certain types of analyses, certain studies.
I mean, the fact that they were able to predict spikes in the flu says that it is useful, right? So it also could be useful in COVID, right? Tracking people's tweets.
Yeah. My colleague is actually doing that. He received a grant to study COVID related tweets. Um,
Nice.
yeah, and some folks in Austria. I was collaborating on a project. We still have to get to it. It's just been busy
Yeah.
seeing how the tweets are potentially correlated with the outbreaks. Um,
Okay.
yeah, so I mean, COVID-19 is not what I got a PhD for. I mean,
Right.
my expertise is in infectious disease surveillance,
Right.
but yeah, that's been kind of the last year, doing a lot of COVID work. But my PhD looked at um, dengue fever, chikungunya, and Zika in Colombia in South America with
So
an O, not a
de-
U.
yeah, Colombia. I know. I have a close friend from Colombia.
Yeah,
Had never went, but so dengue fever and what Zika?
and chikungunya.
I don't. I never heard of chikungunya. I've heard of the other two though.
So all three are caused by the same two mosquitoes, Aedes aegypti and Aedes albopictus.
Love
Um,
mosquitoes.
they also those mosquitoes also transmit yellow fever. Um, fun fact: only female mosquitoes have a proboscis, so they're only capable
Yeah,
of drawing blood from you. The males don't.
I always thought that was the case, but it was one of those facts where like it's so long ago that like I started to question whether it was actually a fact. But
Yeah.
thank you for confirming that. And what about the big things that some people call mosquito eaters? I thought I had heard those were the male mosquitoes. Is that not right? The big ones
What
that they just
particular?
they just look like giant mosquitoes.
I think those are different. Yeah, there's so many different species of mosquitoes, and
That makes
I'm not
sense.
a yeah
Not an
an
entomologist.
entomologist exactly.
Yeah.
So yeah, my work's pretty much just in Aedes aegypti, and
Yeah.
albopictus.
Okay, so
Um,
take us into that research.
so I guess some background: dengue fever is the most, I guess, prominent mosquito-borne disease in the world, more than
Huh.
malaria. It recently overtook malaria for a number of cases every year, and one
Hmm.
third of the Earth's population is at risk of catching dengue fever.
Huh.
It's more common in the tropics, but we've seen local transmission of dengue in Florida and Texas because of climate change and other things. Aedes albopictus and aegypti have
Yeah.
uh, kind of the latitude of their range has shifted more north.
Well,
So
like a lot of species, right? Like the Africanized bees,
yeah,
or even the murder hornets, the misnomer, the
yep,
Japanese giant hornets, right?
yep,
Part of it's probably because of international travel as well.
exactly. So we think that Zika and chikungunya was introduced into South America because of shipping,
Huh.
the cargo ships. The
I thought.
mosquitoes were in a tire
Oh,
because tires are great places for mosquitoes
right.
to um, lay their eggs.
I thought Zika originated in South America.
Yeah, so Zika originated in the Zika forest in Uganda. That's why it's called
Oh,
Zika.
got it.
So it was from Africa originally. Um, and dengue has been endemic to South America for decades. It
Mm-hmm.
was almost eradicated, or it was not really a huge threat, I think in the 80s they saw an uptick because there is less public health campaigns and kind of spraying pesticides, and I guess education, just letting people know, hey, you need to, keep an eye out on mosquito larvae and, anything that could hold water, whether it's a plant, tires, anything in and around your home, because
yeah,
Aedes mosquitoes, they don't bite at night. So mosquito nets are useless for sleep.
okay,
For Aedes. They bite in the evenings and during the day. So what they'll do is when it's hot outside during the day, they will come inside, and we think a lot of transmission occurs within the home. So part of my work was kind of interviewing people. I did a study called the Knowledge, Attitudes, and Practices of Chikungunya, Dengue, and Zika in Cali, Colombia. Cali, famous for the cartels back in the day, but it's kind of the epicenter of dengue in Colombia.
Yeah.
So I interviewed a lot of people from different neighborhoods, different hospitals, and you'd be surprised that a place that has dealt with mosquito-borne diseases, especially dengue, for so long, the education was pretty low about how to prevent it. The best answer I got was that dengue was caused by a horse.
Really?
Yeah. And dengue is interesting because there's 4 serotypes. So there's 4 types of dengue. Okay. With chikungunya and Zika, if you're infected, you're immune for life. But with dengue, if you get infected with another serotype, you're more likely to get severe dengue. And that's when it could get really deadly. It becomes like a hemorrhagic fever. You could have organ failure, bleed out orifices, and all that fun stuff.
We know about
dengue
that.
shock syndrome, but yeah.
So you're saying if you get dengue once, but then you get another serotype, which is like a variant.
Yeah, there's 4 different types of dengue that affect humans.
That's weird.
Yeah, and that's why, we saw a huge spike in Zika, I think back in like the Brazil Olympics 2016, 2016, yeah. The reason why Zika isn't really, well, because COVID is like on everyone's mind, but dengue is still very much an issue in a lot of parts of the world. COVID actually is resulting in an increase in dengue cases in certain areas, but that's for another, before we get into too many
tangents.
Yeah. So what was I saying about?
Well, I mean, you're just kind of talking about
what your
dissertation
Zika
was on. Yeah.
Zika. So Zika and chikungunya, we've seen a lot of declines in certain areas because more people get it. There's more herd immunity because you're immune to it for life. Chikungunya is bad because it causes a lot of birth defects.
And so does
and
Zika.
It's also deadly. Chikungunya could actually, out of the 3, it results in the most amount of chronic conditions after. Like you could have debilitating fatigue for up to 5 years after getting the acute infection. And then for Zika, obviously microcephaly was an issue, babies being born with small heads.
But I mean, they were recommending, I remember telling people to not get pregnant, right? And I think it was a landmark time when, I don't remember if the Catholic Church actually condoned birth control for the first time, but I know there was talk about it.
Yeah, that was a major issue because, they don't believe in birth control, obviously, but Zika was one of those diseases that can be transmitted sexually and through blood transfusions as well. So, it was a really big problem in the Americas and other locations for years, and we still see cases, but it's not as substantial. But because dengue has 4 different serotypes, that's what's really affecting the world and why it's the most kind of severe, not the most deadly arbovirus, but in terms of public health impact, dengue is number 1. And mosquitoes have killed more people on the planet than any other species ever. So
is it the mosquitoes that kill people or the virus that kill? Well, I guess the virus.
Oh, here we go. Chicken or the egg. Yeah.
Yeah, no, I get what you mean though. I mean, I was
But
always taught to be careful of mosquitoes just because of like West Nile virus in the Northeast here.
yeah, that's another issue. A lot of studies have been done to try to see what's, mosquitoes' role in the food chain, and a lot of studies have shown that they're not that important.
Right.
So I was lucky enough to go to the World Mosquito Program in their laboratory in Medellin, Colombia,
Yeah.
where they're doing this Wolbachia campaign. Wolbachia is a bacteria that's found in like 25% of insects.
Okay.
If you infect mosquitoes with Wolbachia, it essentially sterilizes them.
Oh.
So they're introducing all of these genetically modified uh, mosquitoes,
Hmm.
essentially infected with Wolbachia,
Yeah.
into certain areas that have a lot of observed cases of chikungunya, dengue, Zika.
Yeah.
Um, in certain areas, certain neighborhoods in Medellin, actually, they showed a decrease. Now, is it related to Wolbachia mosquitoes? Maybe, but
Right.
there's still a lot of work that needs to be done.
That's really interesting. So they're really actually trying to reduce the mosquito population.
Yeah, by sterilizing them.
Yeah. I wonder if there's other ways you could reduce mosquito population. Introduce more bats, maybe more spiders.
Yeah, and reducing kind of the stagnant pools so they're not able to lay their eggs.
Mm.
Um, so storm drains in Cali, like you would think that I found that not just lower populated areas had a lot of dengue. Traditionally, they did, but we saw a high risk of dengue in areas that were within close proximity to storm sewers. And these are in like wealthy neighborhoods, for example.
Right.
So I identified clusters of dengue, chikungunya, and Zika in like middle and high income areas,
Mm.
which was interesting because it depended on the environment. Um, like again, the built environment, the storm drains, but also, you know, what types of activity occur there. So there's malls in these locations
Mm.
with a lot of plants, a lot of areas that could hold water,
Right.
and you need people and the vector to transmit the virus.
Right.
So, kind of my next step is writing a grant on how mobility affects dengue risk. So, looking at people's movements throughout the day, how does that
Mm.
affect their risk of getting infected with dengue fever and other arboviruses?
What's your prediction?
Yeah, one of my co-mentors found in Pakistan that mobility significantly is related to dengue outcomes depending
Mm.
on where you go. So, you know, we typically think that, or we typically look at it as a static problem that your place of residence
Mm.
will kind of quantify your risk of getting the disease.
Right.
And like I said before, we think that transmission of dengue, chikungunya, Zika happens at home, but from talking to people in Colombia and doing some other research, we know that mobility also matters. Where are
So
people gathering throughout the day, and
right.
why is that significant?
So you're gonna try to quantify people's mobility and see if that correlates with the risk of getting these
Yeah, that's a whole
diseases.
nother
Yeah.
subfield of geography, is network analysis and
Right.
mobility.
Right.
I don't know if you saw any studies on mobility and COVID, but there's a
No.
lot of data sets out there that look at how many people are visiting malls,
Mm.
businesses, uh, parks, and whatever.
Yeah.
And we're trying to see how lockdowns have been effective at reducing transmission by looking at the mobility of people and its relationship to COVID. But you could do that with any disease.
Right. So I feel we've talked quite a bit about your research, which is great because I feel like it's real fascinating, and I've tried my best to understand like some of the mathematical tools, but it seems very complex. So I'm glad that your people like you spend enough time to understand it. But I'd
I
like
went
to,
into grad
yeah,
school without any kind of mathematical knowledge, and
Oh, interesting.
I'm doing like, yeah, programming and statistics every day. So it's just like,
Yeah.
if you really want to, if you're curious about something, spend the time, you could learn it.
Yeah. Yeah, that's a great piece of advice, and I wholeheartedly agree. That's a I like to give some advice on this podcast in case if we ever have like an audience of young people who are thinking about different careers, and I think like you said, if you really want to do something, take the time and be patient, and don't think people are born knowing advanced statistical methods, right? It takes
No,
it takes a good teacher and a course or two to learn it, and then you're good. Soon enough, you'll be talking about stuff in terms that other people have no clue what you're talking about.
yeah, intellect only goes so far. I never did
Right.
an IQ test, and I don't care. I don't want to know what my general IQ is. I just know that
Yeah.
I'm very passionate and curious about
Right.
science and improving public health outcomes. So I want to understand the necessary tools and techniques required
Mm-hmm.
to help other people and
Right.
help students. I've taught 3 college courses and done a lot of workshops, and that's honestly more satisfying than publishing a paper
Mm.
quite often. If you help a student get a job, or they're using the technique you taught them in their thesis or research,
Yeah.
or just motivating them to be a better student, or trying to help them find their passion. I think it's
Mm.
one of the really nice things about being in academia,
Yeah. So you
because
seem
you're
very
not just a researcher, you're also a teacher, which is nice.
yeah, you seem very motivated to help others. I mean, your research is helping people stay healthy, and then also as an educator, you're helping people in their careers. Do you
Yeah,
do you have any idea of like where that desire comes from? Why you like helping people a lot, or is it just kind of like just something you like?
I don't know. Like, growing up, I went to good Catholic school. Like, I don't think that had anything to do with it, but
Mm-hmm.
um, I always had a good group of friends, because we were stuck with each other
Yeah.
every day for 10 years, so
Mm-hmm.
might as well befriend some people. But
Right.
anyways, yeah, I always found myself, I don't know, like, really empathetic and trying
Mm-hmm.
to understand why they thought a certain way. So I try
Yeah.
to listen before passing judgment. I think it's cliche, but a lot of people do judge a book by its cover. But
Yeah.
like, even if I don't agree with you, I want to understand why you're thinking that way, because I think that's something that we all need to do to push or press the issue and to actually make change. Because if you're growing up in a certain place and you're not exposed to certain things, you might necessarily have the education or experience
Mm-hmm.
to, I don't know, think correctly or make the right decisions. You might not
Sure.
have the correct mentors or the correct social network.
Mm-hmm.
um People are really educated, but a lot of people do live in a bubble where they don't try to see what else is out there. So I think this is where geography comes in as well. If you're in one location for your entire life, that influences how you think. And I understand why certain people think a certain way.
Right.
um, doesn't mean they're stupid, but you can kind of understand where they're coming from, because that's all they
Mm-hmm.
know.
Yeah. I mean, I'm
So I
sure
think traveling
geography.
really helped me become more altruistic and wanting to help
Mm.
others, because I understood that a lot of people want the same things in life.
Right.
Culturally, we may be different, but I could still help them in the same way. Um,
I think you also
this,
see a lot of suffering and poverty when you travel in places like Latin America, or even traveling around America's own cities, right? You see things, and if you have a tendency toward empathy, like you said, to imagine what it's like to live in those situations, it's hard not to feel and like you want to do something to improve people's lives, right?
yeah, when I was in Chile and Colombia, I've seen some of the worst slums and
Mm-hmm.
favelas that you would ever see. And
Mm-hmm.
this is where a lot of, disease cases are, and this is where we need to target interventions, but they simply don't have the resources, or there's not enough people in their own community to help them. So this is why I think uh, my dissertation was really interesting, because me, an American coming there wanting to improve public health for impoverished people and just everybody in Colombia. And they even told me, like, we don't have the resources to do what you want to do, so it's great that you're doing this.
So why did you choose to do your dissertation in Colombia?
So my former PhD advisor, Dr. Eric Demel, he's from Belgium originally, but a lot of his work has looked at dengue in Cali, Colombia, because he went to school in Buffalo and met a Colombian, Dr. Irene Casas, who's at Louisiana Tech, who was on my dissertation committee.
Yeah.
So she was like the keeper of the data and the connections.
Gotcha.
So like I got connected and met the Secretary of Health and all these top people thanks to her. So that was really critical for the success of my PhD and the publications I was able to produce because of that. So
reminds you of
connections help. Another piece of advice.
Social connections, right? So we're talking about geographic connections. We're talking about social connections, related but different sort of things.
Yeah, and I was always a shy person, but I was always curious about other cultures and just perspectives, why people think a certain way. So that has allowed me to be more, I don't know, open-minded, I guess, or able to kind of draw from others' experiences, and that kind of informs what I do for research. Or because numbers are one thing, and that was one of the kind of main motivations behind my dissertation was, okay, I have these statistical models that tell me this,
right?
But that doesn't really tell you the people behind the numbers, what is actually contributing to them getting infected. It's so much more than just location and being poor or being I don't know, just in close proximity to mosquito habitats, whatever it may be.
I mean, math is all about abstraction, right? So it's always important to supplement data, like mathematical data, with qualitative research, interviews, and stuff like that. I think sometimes there's a bias in research nowadays. There's so much pressure to do things quantitatively, and quantitative stuff is great, but
yeah, because it's sexy, it makes you seem smart. Yeah, I mean,
but it's also can be extremely useful, right? But I think it needs to be, we can't forget about the qualitative aspect and looking at the broader picture, right?
Yeah, and that's what I tried to do in my dissertation, which I think I accomplished, was tying in the qualitative data, the surveys and interviews, to what I found with my spatial analysis, statistical analysis of the disease.
That's really cool, because I think a lot of fields you have to do an either or. You can either do a quantitative analysis or a qualitative analysis. So the fact that you were able to do both, I think, is really, really cool thing about geography, the field of geography.
Well, geographers have debated, I mean, if you get into the philosophy part of geography, there's the quantitative side and then the qualitative side. And a lot of people just spend their entire careers in one aspect of geography. And I think it's time to find like a golden mean where we could collaborate, not just within the discipline, but with other disciplines as well. And like I was saying before, just collaborating with engineers and physicians, that really draws in other perspectives and skill sets that are needed to actually address the problem from a more holistic perspective, I guess.
Right.
Not just using one perspective because we're trained in one discipline with these certain theories and whatever. So science should be more interdisciplinary.
Right, more crosstalk. Which, I mean, I think I do see trends toward that. I mean, I see teams on some studies made up of statistician and a medical doctor and an epidemiologist.
Yeah, it's definitely very common in public health, and geography is becoming more common. Like I said, I work in the spatial science for public health center, so we're all about we're nested in epidemiology, but we're all about applying geographic techniques to study epidemiology.
Right. It's an
which
interdisciplinary thing.
Yeah. And I didn't even know about, that Hopkins had a center like that until I went to a conference called GeoMed, Spatial Statistics in Public Health and Epidemiology. I was like, oh yeah, I'll apply for a postdoc, and
you got it. Let's talk a little bit. We've been on for a while now, so I think we should start wrapping up.
Yeah.
Just kind of like reeling back from the specifics into the general stuff. What's like some of the things you like and dislike about your work? So some of the perks, some of the things you enjoy, some of the things that are kind of more tedious and feel more like work.
Yeah. I enjoy research. Obviously, I'm in academia. I got a PhD, so I enjoy kind of
discovery,
knowledge discovery, and dissemination, and trying to. I think Hopkins is a great place to communicate your results to a broader audience. I was never really interviewed about my research until Hopkins, and I was able to kind of go to newspapers and whatever in layman's term explain what we're doing, and that I think helps the general public. So I really like that aspect of what science can be, and what I could do is do both things. Go to the technical conferences and talk about the statistics and how we can improve them, but also explain in layman terms to a newspaper or a blog about what you can do to improve your public health or whatever it may be. So yeah, I like teaching a lot. I've been able to teach 3 courses when I was at Charlotte, and I've done some workshops and mentored some students, and that's the other part of academia. People think professors just teach. No, they research, they teach, and they write grants to bring in soft money to support their research and students that they're mentoring.
Of course, especially in sciences. I mean,
yeah,
I don't know about humanities, but I think, yeah.
That's where I think a lot of professors have limitations, is that, they're so smart and brilliant in what they do, but translating it, to teach it to students that never have been exposed to that before could be really difficult.
Tough. Yeah.
And I think being exposed to that early on and being so young in my field, I was able to kind of understand where students were coming from. So I tried to.
Right. Your function as kind of a bridge as a young academic, right?
Yeah. I'm still improving, but yeah, I've had, I think, good success with teaching. And
Can I pause you for a second?
Yeah.
I just gotta run to the restroom.
Sure. Yeah. Yeah. All I'll stop talking. You just ask.
What?
Yeah. Ask away.
So you're talking about you really enjoy being able to kind of disseminate scientific findings to the public. So what's some of the things that you really would like people to know? So, assuming if we ever develop an audience for this podcast, what are some things that you would really like people to know, whether it's about COVID, public health in general?
I think it's difficult being a scientist and in public health, because we do a lot of work behind the scenes, and it's often not portrayed in the correct way, or the knowledge isn't necessarily disseminated in the proper way.
Okay.
A lot of journalists may look at a study and then take their own kind of spin on it. I think we need to do a better job of communicating our results to a broader audience, not just worry about, publishing the papers.
Yeah, this came up actually with my podcast with Slater just the other day.
Yeah.
Yeah, same exact topic.
Yeah, it's not about how many citations you get or how many papers you get. Like, did it actually make a difference? Did it educate people? Did it improve public health? Did it, for sure, address certain limitations and improve science? But I think as scientists, we should be more altruistic and worry about educating the public. But it's become difficult. It's really politicized, and there's so many keyboard warriors that will spread misinformation, and scientists are now viewed as like politicians almost.
Mm,
And I found in my own research that people are more willing to listen to community leaders rather than the scientists themselves, especially in Colombia when I did the dengue work, that we could take our findings, give that knowledge to one person that is popular in the neighborhood,
hmm
and we saw better outcomes in that neighborhood doing it that way than going into the neighborhood as scientists saying, hey, you need to do A, B, and C.
mm. Well, that's psychological truth. I think that the person who's speaking it has so much to do with uh, how people receive information.
Yeah, and it's unfortunate because people will
Yeah.
listen to what Leo DiCaprio has to say about the virus versus Fauci or
Well, I
whatever.
think a
So
lot of people do listen to Fauci, which is good, but it's also interesting that like Fauci is like the guy, right? He's like the face of disseminating information during this pandemic.
yeah, he pays
And
my bills.
oh yeah.
Yeah, my grant's an NIH grant, so it's the same institute, the Institute for Allergies and Infectious Disease. So
Oh, so
thanks Fauci for paying my bills. But yeah,
I'll tag Fauci in the description when I
yeah,
post it.
yeah. But he's also this, you know, villain in a lot of people's eyes. I think Americans. I don't want to. I love the U.S., but I think Americans have this false notion of freedom that
Mm-hmm.
you have to take away some freedoms for a little bit to protect the community.
Right.
So it's a very,
Right.
like I said before, it's not collectivist, it's individualistic. And
Mm-hmm. Right.
that's why there's so many issues.
That's part of our ethos. You know, we're taught from a very young age that America is the land of the free, right?
Yeah.
Freedom is like value number one in elementary school social studies classes, and like I don't know, it's just a myth. You know, it's a mythos because like what the founding fathers really wanted was like they kind of wanted less taxes, and obviously they didn't believe in freedom for their slaves,
Yeah.
right, or for the Native Americans. So it's
The
like
history we're not taught in school.
it's
Yeah.
such a myth, you know, and the
Yeah.
idea that like freedom above all else. I mean, I think if you sit and think about it, there's plenty of things that are more important than freedom, because like we're never totally free in the first place, right? Like you always have to do something, whether even if you lived in the woods by yourself, you'd have to forage for food and build shelter. So you'd say, well, you know I'm not free because I'm a slave to the elements or whatever.
And some
Anyway,
people are able to do that, go back to Alaska and be by themselves for the rest of their life foraging for berries. But I
yeah,
think
not
it's human
most.
nature to be part of groups.
hmm
And it's like the theory of the Leviathan. If people think the same way, the less heterogeneity there is, the easier it is to govern. And
Is
in the
that
US, it's a
from Thomas
problem.
Hobbes?
Yeah, yeah.
Yeah.
So we have a lot of issues in science in the US because of that, I think.
Mm,
And it's become so politicized, and the internet has been so great for so many things, but
right. It's a double-edged sword for sure because
I've
it
been called so
spreads
many, yeah.
true information, but also false information. So you've been personally like attacked.
Yeah. When I was talking to Republican American about my COVID app, actually, they did a study,
So the Republican American is
or I did an interview.
Waterbury's local newspaper, and you can tell where their leanings are.
Yeah. So the reporter was great. Um, but all the comments in the digital version online was like,
Mm-hmm.
oh, just another young liberal brainwashed, uh, blah, 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 fake news, fake
Jesus.
data.
And these are people who probably like maybe have a bachelor's degree or something, but like you have a PhD and this is your job to study how diseases spread.
Yeah. I mean, I'm trying to help you, and
Right.
here's like a tool that could put your health in your own hands. Or
You're talking about the app, right?
yeah, again, it comes down to, people still don't think their data is private, which it is.
Right.
They're giving us information, but we don't know anything about them. We can't track
Right.
them.
And so, how popular is this app? How many people use it?
So when we published it, we had over, or published the paper recently, it was at like over 10,000 users and 100 and maybe 85,000 entries. And most
Mm-hmm.
of our users were within the Virginia, DC, Maryland area, and some
Near
other cities
Hopkins.
based on certain interviews that we did with newspapers or local news stations. So yeah, for national level syndromic surveillance, it's really difficult because you need
Yeah.
a lot of people.
Right.
And in this country, it's difficult. We've Studies have compared the US to other places like South Korea in terms of people's willingness to abide by uh, public health guidelines and participating in contact tracing and
Right.
the apps that we've developed. And yeah, it shows that they're more likely to think like a collectivist rather than.
Yeah, I mean, Americans have kind of an inherent distrust of the government. Well, I shouldn't say all, but
Well, I'm not the
Americans,
government. I could
right, right,
Everyone out
exactly.
there, I
They
am not the
confuse you.
government.
Yeah,
I'm not falsifying data.
right. No, I
What you
mean,
COVID is real. COVID is
I just
killing.
mentioned that because you're talking about compliance with public health measures and stuff. So, like, I think Americans, more than any other, well, more than a lot of nationalities, don't want the government like telling them you can't do this, you can't do that, right? But yeah, the app is voluntary. It's private. What's the app called?
COVID control.
COVID Control. So I can download it and I can report my symptoms.
Yeah.
So does it?
covidcontrol.jhu.edu.
It pings me every day to report my symptoms.
Yeah, you could turn on notifications and it'll give you notification at any time you set it.
I might just do that.
And you could see your real time or kind of near real time results of what everyone else is uploading.
I might be the only data point in Waterbury, but
No, Waterbury saw an uptick because of that Republican American interview, but
yeah,
they did a poll on the website, and I think 65% or more said no, they're not going to download the app.
yeah,
So
it makes sense.
it's just the challenges of, I guess, educating people, but
Sure.
people
Yeah.
don't, even if people are educated, it becomes a political issue. And then we could talk about that for another 2 hours, but
Well,
you
I
know,
really think that the more people are properly informed, like the better, like they make better decisions and it becomes less political thing. I really like, so coming from a science background
yeah,
myself, I have kind of disdain for a lot of political debates because I feel like there's not enough data and there's not a certainty about, like, some people say, well, we should do this, and the other side says we should do this, but it's not really clear which is going to be the better outcome in a lot of political debates. In this case, it's like there's really no downside to downloading the app. So I think, for something like this, when people are properly informed, there shouldn't really be a quabble. It shouldn't. Hopefully, the political problem disappears. I wish that were true for all political debates.
yeah, and political debates is a lot about believing, but science is about knowing. So that's
Right.
where there's the difference in
Right. It's like we don't need to
polit.
debate. Like we
Yeah,
know. Yeah.
and scientists aren't in control of the laws and the policies. They're just there to inform. And
Right.
unfortunately, politicians could take it any way they want, whatever
Mm,
positively influences their approval ratings and
sure.
keeps them in office, whatever it may be. But
Um,
yeah,
so I wanted to share
any other
one
questions? Yeah.
one success story of this sort of thing, which you might not have heard of, using like technology and phones to improve public health. This was a talk by a professor at my alma mater, Swarthmore, that I saw,
Mm-hmm.
and they
Grade
did
school?
grade school. Yeah, they don't. No,
No, I said great school.
it
It's
was all right.
prestigious. Yeah.
So they did a study in Africa for people with was it, I forget, not malaria, I don't think, but there's a disease where you get it, and if you take the medication, you're almost guaranteed to recover fully, but you
Mm-hmm.
have to take it like every day religiously for like a long period of time, like 6 months or something. Do you know what disease this is?
There's a lot of diseases like that.
It's like, but it's like you have to take a pill. So it's
Do you
like you
know
get it.
how it's caused or transmitted? Is it
See, I
waterborne?
don't remember. It was a major one, so I want to say maybe malaria, but that seems not right. But it was like you had to take a pill every day for like 6 months, and then you'd essentially be cured. But you just had
Mm-hmm.
to do it every day. And so it used to be like they'd have to go and like to the clinic and get the medicine from the nurse every day. But then I think they changed it where the people could take it home with them for like every week or something like that. And they still had this huge problem with compliance. And they're like, if we just got people to take their medication every day, then
Mm-hmm.
we could really like make a huge decrease, make a huge dent in the rates of this disease. And so they did. Most people in Africa have like cell phones, but not smartphones.
Yeah.
So they couldn't do an app. So what they did was like a texting program.
Mm-hmm.
And initially, they got some promising results by just sending people a text every day to like take your medicine. But then they said, how can we make it even make compliance better? Because it was a pretty small improvement that they made. So they decided to add a human component where instead of just a text, they would have somebody call you, and it would be people from your own community. So,
Mm-hmm.
like local people from your town, and it would be people who were volunteers, most of whom like had relatives that had died or been seriously affected by this disease.
Mm-hmm.
So there's a real personal connection where you had somebody calling you, like whose uncle might have died from the disease, reminding you to take your medication so that you don't die also. And with that, they found huge improvements in compliance. That's just a like nice success story of using technology, but also using the power of relationships and like um, how do you say, using like psychology, right? Knowing that people are more likely to, not always rational, right? More people's behavior can be influenced by something as small as whether they get a phone call versus a text.
Exactly. And that
Yeah,
kind of goes along with what I was saying before about, reducing dengue, that the
right,
community leaders are more likely to
right.
educate the people than the scientists or their
This is
um
the field of behavioral economics really
yeah.
studies this, how like little things can have huge impacts on people's decision making.
Yeah, and I think public health could benefit from looking at those types of studies, and health communications like another subfield in public health, but that's something I really want to get more involved with. And you know someone on Facebook that doesn't have a background in science probably has more power in spreading information than me because people know them
Yeah.
and trust them per se. So
Oh man, imagine like, I mean, not to pick on like the Kardashians, but
yeah.
just people who are like famous for being
Yeah.
famous, who don't really have expertise in
Mm-hmm.
anything, but like they can do so much. And like, I mean, Bernie Sanders was doing campaign interviews with Cardi B and
Yeah.
other stuff like that just because they're so popular, and like anything they say is
Yeah,
going to be
Kanye with
heard.
Trump, and yeah.
Yeah, anything they say is going to be heard by so many people. So it's unfortunate that a lot of people who are real experts don't have as much of a platform, but um, you know, we have to take advantage of what exists and sometimes find a platform, I guess.
Yeah, and benefiting from dedicated PR campaigns from the
Sure.
beginning could help. And
Yeah.
I'm proven wrong, science is proven wrong, it's part of science. That's why the whole COVID thing has been so politicized and people don't trust certain things.
Mm-hmm.
It was so new and it was so overwhelming.
Right.
Like, we've never experienced a pandemic before like this, so
Right.
especially for a disease that's so infectious
Right.
and globally. So it takes time to understand things, and people,
Mm-hmm.
they don't want to just, they get fatigued really easily.
Sure.
So I mean, we could talk about this another time, but just like
Yeah.
the whole
we
lockdown
might.
debate and whatever. But yeah.
Yeah, we might have to do a second episode because there's a lot more we could talk about. But I think
Yeah.
it's a pretty good place to stop. I think hopefully we've done a little bit to increase public, to inform people a little bit better about what it's like being a researcher, how geography works in the world, and also like how we're continuing to try to fight the virus, and hopefully people are more compliant with the recommendations of public health experts.
And I'm by no means an expert, but but I
Well, you're an expert on some
think,
things, not necessarily on like, not on all aspects of public health.
yeah, of course. But yeah, I hope it was informative for you and whoever's listening.
Yeah.
Especially the geography part. I think a lot of people don't realize what the discipline actually does and how, I mean, yeah, technical for sure. It's a difficult discipline. Like it's hard to get a master's and PhD, and it's
Yeah.
a really interesting field, and I think it'll grow as more people realize its kind of power using
Def-
spatial analysis, because
Definitely makes me wish I did a degree in geography.
or even a minor, it'd just be fun to have some classes
Yeah.
under your belt. Yeah.
I mean, my minor was in philosophy. Go figure. But
Well, I'm a doctor of philosophy, and you probably know more about philosophy than me. So
philosophy can be anything, man.
yeah.
But yeah. So we'll wrap it up there. Thank you, Dr. Mike, so much for your time. Hope to see you on Among Us later tonight.
Yeah. Time to get sus, and
Yeah.
Sam is the most sus. I know you did an interview with him, so
Sam,
another young upcoming scientist. So
soon
that's
to
great.
be PhD. Yeah.
Yeah.
But yeah. So thanks again for your time and take care. Till I see
Yeah,
you
of
next.
course. Thanks,
Bye.
Dan. See you.